Hi, I'm Dr. Amber Buller, Cardiology Fellow at Mayo Clinic in Rochester, Minnesota. We're here at ACC 2018 with FITsontheGO video blog, and I'm joined by Christine Lagrasta, nurse practitioner from Boston Children's Hospital. She's the poster winner for the CB team in Pediatric Cardiology Division. Thank you for joining us today.
Oh, thanks. It was great. It was a great morning. It was a great poster session.
Can you tell us a little bit about your poster?
Sure. This was part of my DNP project. I go to Northeastern University. So what we did was we looked at pneumothorax rate or incidence in pediatric post-op cardiac surgical patients. And even though that we knew the incidence or it was low, we wanted to describe what was going on at Boston Children's Hospital. We reviewed about 8,800 patients, so it was a big cohort, and only 16 of those patients had developed a pneumothorax after chest tube removal. And that 1.8% incidence is pretty low, and that's consistent with the adult population. But what we also found was that a lot of those patients, of those 16 patients that developed a pneumo, did not have any kind of respiratory compromise, even though they might have had moderate and large pneumothoraces, which is unlike the adult population that will tell you if there is a change in respiratory status or they're having some types of problems with breathing. So we're not sure what to do yet. Not sure, but we'll probably continue our practice of getting chest X-rays after chest tube removal, and then we're going to look at this cohort, the 16, compared to the 8,800, and see if there's any risk factors or if we can develop a risk model, and that would help the clinicians taking out the tubes.
This is very important research that you're doing.
It was a great project.
It's very interesting. Can you tell us a little bit about your interaction as an advanced practice provider with the pediatric cardiologist?
Sure. Well, I've been at Children's Hospital for 18 years, and 8 of that has been as an advanced practice provider or nurse practitioner. The role is great there, meaning that there's a lot of autonomy in both the cardiac surgical and cardiology worlds. We have a ton of physician support, and we work collaboratively as a very big part of that team. So it's a great role.
And this model of care, kind of the care team, is really the way of the future. So your role is very important. Can you tell us a little bit about the adult congenital population and kind of how that's merged with pediatric cardiology?
Sure, of course. We have the BOC program in Boston. It's the Boston Area Congenital Heart Program. And what we found is that the adult patients are growing because they're doing well. There's better medicine, there's better follow-up care. It's starting to get better, improve. So we work with the BOC team, which is the adult congenital heart program. So we take care of those patients. They can be up to 10 to 20% of our population at Children's. So we take care of the newborn all the way up to the adult patient, and trying to figure out their needs and dealing with what kind of things that they need to do to continue to thrive.
Well, thank you so much for joining us today, and thank you for what you're doing at Children's Hospital. For more videos like this, head to youtube.com/FITsontheGO.